A very good evening to all of you. I'm Dr. Hardik Thakur. I'm a practicing MD in internal medicine from Mulund, and I will be speaking today about tuberculosis. As we know, tuberculosis is a very common infectious disease that we see in India. It is caused by a bacteria which is called as Mycobacterium tuberculosis, and it can affect different parts of the body. The most common part that is affected is the lungs. So the patient usually comes with history of fever for a long time, like 2 to 3 weeks, along with a cough which is not responding to regular medications. Sometimes the patient even complains of weight loss and even blood that comes out from the sputum. So these findings are very typical of tuberculosis. However, apart from the lungs, it can also affect certain other parts of the body like the brain, wherein the patient may come with seizures and even unconsciousness. This is very common in children and people with decreased immunity, like patients with HIV, patients with diabetes, patients who are malnourished. TB can also affect other parts of the body like the genitourinary system and even the bone. Spine is a very common site for bone TB. So here the patient will usually come with fever, weakness and pain in the back, and sometimes the patient will not be able to make any movements. That is, he will have weakness in his legs. It is called as paraplegia. So this needs prompt attention, because if not, this can even lead to problems in the bowel and the bladder movements of the patient. Apart from this, you can have the affliction of the pericardium and so on. So TB is very easily treated these days. However, there are two types of TB, the common TB and the MDR TB. So MDR TB is the one which is a little bit difficult to treat, because here the organism is resistant to multiple anti-TB medications. So here we have to do the culture sensitivity test and then treat the patient accordingly. So anyone who has got fever for a long time and who is having a chronic cough should report to the doctor immediately. Also, a point to be noted is tuberculosis is very common in patients who have HIV. So every TB patient is always tested for HIV, and if he does have the disease, we have to first start the treatment for the TB, and after 2 weeks of the anti-TB medication, we start for the HIV treatment. For more details about tuberculosis and its treatment, you can reach me on my website through Libraid, which is libraid.com/Hardik Thakur. Thank you very much.